So if you've just had a joint replacement or you're thinking about getting one and you want to know what to do after you get the joint replacement, let's talk about that, because a lot of mistakes can be made both beforehand and then also incredibly after. Those mistakes can result in a lot of challenges down the road that you don't want to suffer, you don't want to experience. So let's talk about that. Very common for people to go in with the mindset of researching the doctor, and it's all about the surgeon. Think that oftentimes these orthopedic surgeons, they've done all these different joint replacements. They've done this many times. And oftentimes when we know that a joint replacement went wrong, we're able to know afterwards, and we're able to tell 6 months, 2 years, 3 years, 5 years afterwards. And I've only seen that a handful of times. It's very rare that I've seen where the joint replacement went wrong at a fundamental level, at the surgery level. Now, of course, there can be infections and all sorts of things that can go wrong. Like any procedure, a joint replacement can go wrong. And there's nothing wrong with looking at the surgeon and knowing who's going to be doing the surgery and all that. And do it. I highly empower you to do that. And it's good advice. However, don't forget about the rehab professional afterwards as well, because it's very likely that the problems that arise from a joint replacement are due to the rehab process afterward, not the surgical procedure itself. Because when a surgical procedure goes wrong, we as rehab professionals usually know about it. It's very clear when a surgical procedure goes wrong. However, it's more common for people to have problems with the joint replacement, and it's something more subtle and you can tell, and it's usually during the rehab process. It's not during the surgery, it's during the rehab process. And this is counter to what most people think. So what do you do about preventing problems with the joint replacement? So first off, the evidence well supports that if you do rehab or physical therapy or exercise more before the joint replacement, then your likelihood of positive outcomes is much better. You're more likely to get the result that you want, and you're far more likely to have less complexity and less problems. So you want to work on strength and motion and just general movement and general physical activity. And you want that joint and the rest of your body as well to be as good as possible. You also want to make sure that you're as fit as possible, because remember, you're going under general anesthesia during a joint replacement. They're going to knock you out. So anesthesia is going to be going to your brain. And the older and more medically complex you are, the more likely that anesthesia can affect your brain and affect your cognition. So you want to make yourself less medically complex. You want to do things that will improve your cardiovascular and breathing. You want to do things that will improve your cardiovascular abilities. They'll improve your health overall. You want to go into that surgery as good as you can possibly be to set yourself up for success and reduce the risk of complications as much as possible. So the healthier that you are, the more fit you are, and the stronger and more flexible you are, the more likely your outcomes will be better. Now, let's talk about after the fact. Again, we talked about people putting overemphasis on the surgeon. And again, research the surgeon, that's all very well and good. But don't forget about figuring out where are you going to go after this procedure. What is the physical therapy location? Who is the physical therapist? What is the environment going to be like? Is it right for you? Is it going to be home health for a short amount of time afterwards and then go to outpatient? Is it going to be getting rehab at a big hospital institution and they have a large outpatient facility that's connected to a research center and all this stuff? Or is it going to be the outpatient clinic on the corner? If you're older and more medically complex, are you going to need to go to a rehab facility afterwards? Whether it's an intensive multidisciplinary team of different professionals in an inpatient rehab setting where you're going there for about a week and you're going to get very good intensive rehab for a short period of time before you go home? Or are you going to need to go to a skilled nursing facility, a nursing home, something to transition from the hospital before you go home? So you want to know all these different things. You want to know the process. You want to talk about what are the potential outcomes. What is home going to be like? You want to think about the home environment. You want to plan for the home environment. So these are the types of mistakes that can be made that people aren't thinking about. They're putting all their time and energy and effort into researching the surgeon. The surgeon is much more like an airline pilot. You don't research the airline pilot and figure out everything about them before you jump on the plane. There's a very good possibility that that plane is going to go just fine and you're not going to have any problem. And a surgeon can be very similar. Not completely, and go ahead and research them. but it is much more similar like an airline pilot than anything else. So think about the rehab process and don't put all the time and energy and effort into the surgeon. Now, the other mistake, of course, people will make is not going through with the full rehab process that's recommended or prescribed. And especially a big mistake is not doing the exercises that are given to them. Now, this is a window of time where you need to get a certain amount of motion and strength back into the joint that has been replaced and the joints around it above and below. And you need to get your body very tuned up very fast, and you need to control pain and all these different things going on. So you want to be sure that you adhere with what is prescribed to you. And it's amazing the number of times that people will put off the rehab, or if a medical condition comes up and then they'll put off the rehab even further when it didn't need to be put off. They could have done both. Or maybe they will do half of the rehab process and not the rest, or half of the frequency, but not necessarily what's prescribed, because there's a lot of manual treatment that needs to go in as well. So it's not always about just doing the exercises that are prescribed. But the biggest mistake that people make is not doing the exercises as well as they need to, or not doing the exercises at all. And that's when several months or years down the line, that person will very likely end up walking funny, or they'll have problems that with motion or strength, or they'll begin to have back or knee or foot problems. So the joints above and below, or their walking just won't be what it was before the joint replacement. Because with the joint replacement, you should get very, very good results. And if you play your cards right, and if everything goes as expected, you should get amazing outcomes, generally speaking. And so, but a lot of work needs to go into that. A lot of time and energy and effort needs to go into that rehab process, and that healing needs to take place. And it's not going to happen overnight. There needs to be patience with it, and you need to work very hard in order to rehab that joint replacement and the rest of the body back to where it needs to be. And of course, one of the main things that people forget about is the hip strength. Especially with knee replacements, all the emphasis is on how much the knee will bend and straighten, and the muscular control around the knee and all that, which is very important. However, sometimes either because of the rehab professional or the patient or client or whatever, they'll forget about the hip strength, the muscles that stabilize the pelvis. And that can become a major problem with either a knee or a hip replacement for many reasons. But those are the muscles that often get ignored with especially knee replacement. So you don't want to forget about those muscles. And so in general, you want to focus on the motion and the strength above the joint and below the joint, and not just obsess over the joint itself. There's the rest of the body to contend with as well. So if you're about to go into a joint replacement, or if you've had one, or you're suffering with challenges from a joint replacement, this can be helpful advice for you. Now, if you've had a joint replacement and you're suffering with some of these problems, don't give up on it. Don't think that it's too late. Find a rehab professional that will give you the time, care, and attention to be able to work through those challenges and figure out what's going on. Why is the walking not where you want it to be? Why is the knee not straightening out as far as it should? Why is the hip not moving back as far as it should? Why am I still having problems lifting up my leg? So all these challenges very commonly can and should be addressed months or years later if they're not where you want them to be. So that can be another reason, and another mistake that people will do. They'll give up on the result. So you should have great results, and if you didn't get great results, then pursue it. Don't give up on it. So if you want more information and you want more powerful information for yourself or someone you care about, click the link below, subscribe to this channel, follow this channel, and we'll get more helpful information out to you.